Welcome to the Depth Dive. Today we're tackling a really interesting, though actually not very common, condition in dogs and sometimes less often in cats. It's called intrahepatic arteriovenous malformations, or AVMs.
Hmm.
Basically, think of the liver's plumbing system. Arteries bring blood in, veins take blood away from the gut. An AVM is like a short circuit, a faulty connection where these two systems hook up directly inside the liver.
Exactly. It's like a shortcut that shouldn't be there.
Yeah.
So instead of the arterial blood doing its job feeding the liver tissue and the blood from the gut getting filtered properly,
That is mixed.
they mix directly, yeah. And this completely messes up the normal blood flow pattern and, well, how the liver is supposed to work.
Okay, let's unpack that. So what's the immediate problem with this faulty connection?
Well, the big one is something called hepatofucal circulation. Bit of a mouthful, I know.
Ah, yeah.
Basically, think of the portal vein bringing blood to the liver. With an AVM, the pressure changes mean blood starts flowing away from the liver in that system. It reverses.
Away from the liver, so it backs up.
Exactly. And because of that backup, the body tries to find detours. These are the acquired portosystemic shunts. We call them APSS. So blood that really needs liver filtering starts bypassing it altogether, heading straight back towards the heart.
And that lack of filtering, that's where the real trouble starts brewing, isn't it? The liver's not getting to do its detox job.
Precisely. And one of the more obvious signs people might see is ascites. That's fluid building up in the belly.
Right, like a swelling.
Yeah, noticeable swelling. It's all part of this chain reaction from that initial bad connection. The pressure gets so high in the liver's vessels that fluid just kind of leaks out.
Okay. Now, who are we most likely seeing these intrahepatic AVMs in?
It's primarily dogs. We do see it in cats, but honestly much less often. And what's interesting is if it's congenital, meaning they're born with it, we typically start seeing signs before they're about 2 years old.
So often something they've had right from the start. Are there like specific breeds, or is it more common in males or females?
You know, based on what we know now, there doesn't seem to be any specific breed or sex predisposition. It seems pretty random, actually.
Got it. So a young dog, any breed really, what sort of things might an owner notice, or what might make a vet suspicious?
The signs can be, well, they can be pretty varied. Sometimes they creep up slowly. Other times it seems quite sudden. But the main problems usually link back to that high pressure, the portal hypertension, and those bypass shunts, the APSS.
Okay.
The really big things to look out for are the ascites, the belly swelling we mentioned, and something called hepatic encephalopathy, or HE.
HE, hepatic encephalopathy. That sounds serious, like brain issues.
Yeah, essentially. Think of it as brain fog or dysfunction. It happens because toxins that a healthy liver would normally clear out are bypassing the liver and reaching the brain.
Wow. So how does that actually look in a dog? What kind of signs?
It can range quite a bit, from
Yeah.
just being really tired, lethargic, to quite noticeable behavior changes, confusion, maybe seeming dull, or even seizures if it's severe.
Seizures too. Okay.
Yeah. And here's something quite interesting, actually. Dogs with these congenital intrahepatic AVMs might appear to grow normally even when they switch to solid food as puppies.
Oh, how is that different?
Well, animals with other types of congenital liver shunts often show signs of HE much earlier, especially when protein intake increases with solid food. So this seemingly normal growth could be a subtle clue pointing towards an AVM instead.
Huh. That is interesting. A potential diagnostic clue right there.
Why not?
What about other, maybe less dramatic signs?
Sure, you might see things like just ongoing lack of energy, poor appetite, maybe vomiting or diarrhea that just lingers, weight loss, even if they seem to be eating okay, drinking and peeing a lot more than usual.
Polydipsia, polyuria.
Exactly. And of course, that abdominal swelling. Less commonly, we sometimes see urinary stones, uroliths, which can cause blockages and pain when urinating.
Okay. And if a vet examines them, what might they find on the physical exam?
Well, apart from maybe noticing the lethargy or poor body condition, that ascites is often pretty obvious if it's present. Interestingly, the liver itself might feel normal-sized or even small because most of it isn't getting the right blood flow.
Except for the affected part.
Right. The specific lobe with the AVM can be enlarged, but you often can't feel that easily, especially early on. And very rarely, a vet might actually hear something called a bruit.
A brute? What's that?
It's like a whooshing sound.
Yeah.
You listen with a stethoscope over the liver area, and you can sometimes hear the turbulent blood rushing through that abnormal connection. It's quite uncommon to hear, though.
Like hearing turbulence in the blood flow.
Got it.
Yeah.
So we talked about these often being congenital, present from birth. But you mentioned they can be acquired too. How does that happen?
Yeah, while it's less common, they can develop later in life. Things like significant abdominal trauma, maybe chronic inflammation, or even tumors could potentially cause these abnormal connections to form between vessels.
So not just injury, but disease processes too, right? And even in rare cases, things like previous abdominal surgery, or maybe even a diagnostic procedure like a liver biopsy have been suspected. So yeah, it's not always something they're born with.
And the core problem driving all these signs seems to be that increased pressure in the portal system, right?
That's the crux of it, yes.
Yeah.
You've got higher pressure arterial blood forcing its way into the normally low pressure portal vein system. That creates the back pressure, the portal hypertension.
And that pressure then leads to the other problem.
Exactly. It drives the development of those acquired troy, shunts the APSS as the body desperately tries to find alternative routes for blood to get back to the heart, bypassing the high-pressure liver. It's like a traffic jam forcing cars onto side roads.
Okay, that makes sense. So, with all these possible signs, how do vets actually confirm it's an intrahepatic AVM? It sounds like quite a few symptoms could overlap with other conditions.
Oh, absolutely. It's definitely a bit of detective work. You have to rule out a whole list of other things first. Those neurological signs, the HE.
Yeah.
You need to consider things like infections, say distemper, maybe toxin exposure like lead, structural brain issues like hydrocephalus, epilepsy, even other metabolic problems that can affect the brain.
Wow, okay. That's a lot for the brain signs. What about the fluid in the abdomen, the ascites?
For ascites, well, you've got to think about heart failure, definitely. Also, certain kidney diseases where they lose a lot of protein or conditions where protein is lost through the gut. And, even internal bleeding could cause fluid buildup.
Right. And if you suspect portal hypertension itself,
Then you need to consider other types of liver disease, maybe congenital liver structure problems, something called non-cirrhotic portal hypertension, actual cirrhosis, or even a blood clot blocking the portal vein.
so it's a process of elimination, really. Plus, looking for specific clues. What about blood tests? What do they typically show?
Blood work often gives us some really useful hints, though it's rarely enough for a diagnosis on its own. We often see the red blood cells might be smaller than normal. That's microcytosis. And you might see oddly shaped ones called target cells. These can suggest there's some kind of portosystemic shunting going on.
Anything else?
Yeah, typically the albumin, which is a key blood protein, is low. But other proteins, the globulins, might be normal or low. Liver enzymes like ALT and ALP can be surprisingly normal or maybe just mildly increased.
Interesting.
We also might see a low BUN, blood urea nitrogen, and low cholesterol. And usually these animals aren't jaundiced, so no yellowing of the skin or eyes.
What about urine tests? Can they help?
Yes, definitely. The urine is often very dilute. We call it hypostenuria or isostenuria. But the really big clue often is finding ammonium biurate crystals in the urine sediment.
Ammonium biurate crystals. Why are they significant?
Seeing those crystals is really, really suggestive of high ammonia levels in the blood, which is exactly what happens when the liver's filtering function is bypassed by shunts. It's a strong pointer.
Okay, so those crystals are a key piece. Are there other, more specialized lab tests?
We might run coagulation tests, checking blood clotting. Results can vary, but low activity of something called protein C can also hint at shunting. Measuring bile acids is really useful too.
Bile acids. How does that work?
You measure them before a meal and then again afterwards. Pre-meal levels might be normal, but the post-meal levels are usually way up. It's a classic pattern when blood is bypassing the liver after absorbing fats and things from the meal.
I see.
And while you can measure blood ammonia directly, finding those urine crystals often makes us pretty confident about it anyway. Oh, and if we do tap the abdomen and analyze the fluid, the ascites fluid is typically what we call a pure transitate, very low in protein, or maybe a modified transitate.
Okay, so blood and urine tests give strong suggestions.
Right.
What about actually seeing what's going on inside? Imaging.
Imaging is absolutely crucial. Standard x-rays might show the fluid, obviously. They might also show the liver looking small overall, or maybe normal size, even though one part is enlarged. Sometimes the kidneys look enlarged too. Chest x-rays are usually clear.
And ultrasound. That sounds like it would be really helpful for looking at blood vessels and flow.
Abdominal ultrasound is a key tool here. You can see the fluid, but more importantly, you can often identify the enlarged liver lobe that actually contains the AVM.
What does the AVM look like on ultrasound?
You often see these sort of twisty tubular structures filled with fluid. They look black or anechoic. That's the AVM vessels. And then using Doppler ultrasound.
That's the one that shows blood flow.
Exactly. You can see and often hear really turbulent, sometimes even pulsating blood flow within those abnormal vessels. You might also see weirdly shaped branches of the hepatic artery or portal vein nearby. And critically, you can often directly see the reversed hepatofugal flow in those acquired shunts.
Wow. So ultrasound gives a lot of detail.
It does. It can also confirm kidney size, check for those urinary stones, and importantly, help rule out a blood clot in the portal vein as the cause of the problems.
So ultrasound is powerful. What about even more advanced stuff like angiography or CT scans?
Well, the kind of gold standard, the definitive confirmation, is radiographic contrast angiography, specifically hepatic arteriography,
Meaning you inject dye into the arteries?
right into the artery supplying the liver. That directly shows the abnormal connection between the artery and the vein. Just injecting dye into the veins, a portogram, only really shows you the acquired bypass shunts, not the AVM itself.
Okay. And CT.
Multi-detector CT scans are a fantastic, non-invasive alternative these days. You inject contrast dye intravenously, and you can get incredibly detailed images of the liver's blood supply in different phases, arterial and venous. You can even create 3D models to really visualize the AVM, the enlarged lobe, maybe areas where the liver is shrinking. It's very informative.
Sounds really comprehensive. I also saw echocardiography mentioned in ultrasound of the heart. Why do that?
Ah, yes. That's important, mainly to rule out heart problems. Things like right-sided heart failure or problems with the sac around the heart or even blockages in the big veins leading to the heart. These can sometimes cause similar signs, especially that fluid buildup, the ascites. So you want to make sure it's not primarily a heart issue.
Makes sense. And are there any sort of last resort diagnostic procedures, more invasive ones?
If imaging is still not giving a clear answer, then exploratory surgery, a laparotomy, might be done. And taking liver biopsies, samples from both the obviously affected lobe and parts that look normal, can be very revealing under the microscope.
What do the biopsy show?
Interestingly, even the tissue that looks okay to the naked eye often shows major signs of arterialization, basically being overwhelmed by high-pressure arterial blood flow. Sometimes it's even more severe than what you see with other kinds of liver shunts.
Okay, so diagnosis confirmed. What happens then? How do you treat intrahepatic AVMs?
Well, the first step is often getting the animal stable, which usually means hospitalization,
Mm.
especially if they have significant HE, that brain fog, or a lot of ascites.
So supportive care first.
Exactly. Nursing care is key. Diet is a big part of the job. You need to restrict protein to lower the burden of toxins and ammonia, and restrict sodium to help manage the fluid. For the HE, you manage any underlying issues like gut parasites or electrolyte problems, treat any infections, and use specific therapies to cut down on toxin production and absorption from the gut.
Okay. And managing the ascites, the fluid.
That involves restricting activity, keeping sodium low, and using diuretics, usually a combination of furosemide and spironolactone, to help pull off fluid.
What if the diuretics aren't enough?
If the fluid buildup is really bad, causing breathing problems or just making them miserable, we might need to do a therapeutic abdominocentesis, basically,
Mhm.
carefully draining off some of that fluid with the needle.
Right. Now, what about fixing the actual problem, that abnormal connection? Is surgery an option?
It can be. Surgically removing the affected liver lobe, lobectomy, is possible, but it's challenging surgery. And the problem is sometimes there are multiple microscopic AVMs scattered elsewhere in the liver that you just can't see or remove. So a complete cure with surgery alone is, well, it's pretty rare.
So surgery is tricky. Are there other approaches?
Yes, a more targeted approach that's sometimes used is called percutaneous selective acrylamide vascular embolization.
Okay, break that down.
It involves using catheters, guided by imaging, to get right into those abnormal AVM vessels and inject a substance like a special type of glue or coil to block them off, embolize them.
Does that work?
It can provide significant improvement, sometimes temporary, sometimes maybe even curative, but it's not without risks. You could potentially block off the wrong vessel or cause clots elsewhere. It's a specialized procedure.
And you mentioned something earlier not to do.
Yes. It's really important not to just try and tie off those acquired shunts, the APSS, or put a band around the main vein, the vena cava. That doesn't fix the underlying high-pressure problem in the liver and can actually make things worse. You need to target the AVM itself if possible.
Got it. So target the source. What other medications might be involved besides the ones for HE and ascites?
Well, if there's any evidence of bleeding tendencies, you'd address the underlying clotting issues. If there's concern about bleeding in the stomach or intestines, you might use acid reducers like famotidine or omeprazole,
Okay.
maybe gastroprotectants like sucralfate 2. And as I mentioned, always treat any gut parasites as they can worsen HE.
And are there specific drugs to avoid?
Absolutely. You have to be really careful. Avoid drugs that are heavily metabolized by the liver because it's already compromised. And avoid drugs that affect certain brain receptors, the benzodiazepine ones, because they can worsen the HE significantly.
Okay, so treatment is multifaceted, managing symptoms, maybe trying to fix the AVM.
Right.
What about long term? How are these animals monitored?
Ongoing monitoring is definitely needed. Regular blood work is standard, maybe monthly at first, after treatment or stabilization, then perhaps every few months long term.
What are you checking for?
You're looking at things like albumin levels,
Mm.
any signs of infection, how well the HE is controlled, and whether those ammonium biurate crystals are still showing up in the urine, basically tracking liver function and the effects of the shunting.
And what's the overall outlook, the prognosis for dogs with intrahepatic AVMs?
Generally, the prognosis is considered guarded. It's serious. If surgery or embolization is successful in significantly reducing or eliminating the AVM flow, the outlook can be fair, maybe even good in some cases.
No.
But because there are often those underlying microscopic vascular issues throughout the liver, and the acquired shunts often persist to some degree, most patients end up needing long-term dietary changes and medical management for HE and ascites for the rest of their lives.
So for many, it's more about long-term management than a complete cure.
Often, yes, it becomes about maintaining the best possible quality of life by managing the consequences.
Okay, so to quickly recap for you listening, intrahepatic AVMs are these rare but pretty serious abnormal blood vessel connections inside the liver. They cause high pressure and bypass the liver's filtering function, leading to signs like fluid buildup, ascites, and brain dysfunction, HE.
Hmm.
Diagnosis takes careful work ruling out other conditions, using blood tests, urine tests, and especially advanced imaging like ultrasound and CT. Treatment involves stabilizing the patient, managing the HE and ascites with diet and meds, and sometimes attempting to surgically remove or block the AVM itself.
And a couple of really interesting points we touched on. Remember that sometimes these dogs with congenital AVMs might have that surprisingly normal growth transition, unlike other shunt cases.
Right, that subtle clue.
Yeah. And also the fact that even the normal-looking parts of the liver can show significant microscopic vessel changes really underscores how widespread the underlying issue can sometimes be.
Absolutely. And I think for anyone listening, this deep dive really highlights, the intricate connection between blood flow, how organs work, and overall health. It shows how a seemingly localized vascular problem can have huge systemic effects.
It really does.
And it also showcases, I think, the complexity of veterinary diagnostics and the kind of multi-pronged approach needed for managing these tough conditions.
Which leads to maybe a final thought for you to ponder.
Yeah.
We mentioned that AVMs can sometimes be acquired, maybe after trauma or surgery. So it makes you wonder, what other, maybe seemingly unrelated medical events or procedures could potentially, in rare cases, have unexpected long-term consequences for the blood vessels hidden deep within the abdomen? This reminds you how interconnected everything really is.